This is Healthcare Bill Part number 27. We are still on page 28 and we are covering Section 1104, Administrative Simplification. The purpose of Administrative Simplification, Section 261 of the Health Insurance Portability and Accountability Act of 1996. So anybody that wants to flip through there, find Section 261 of the Health Insurance Portability and Accountability Act of 1996. You are welcome to do that. Pop it down here. We'd love to hear from you. Okay. Now, they have a 42 USC 1320D note. This apparently has been amended. They are going to insert the word uniform before the word standards. And you know what? I'm going to go ahead and look this one particularly up here. If you'll be patient with me for just a second. I'm going to go ahead and look this up because this is interesting. They're actually inserting words. And so if you'll just give me just a second here. Section 261. 261 of... Well, here, let's just not you use the word of. Let's just go ahead with health insurance portability. Okay. All right. I think I have found it. We have actually found the Health Insurance Portability and Accountability Act of 1996 is what we were referring to. And we are now going to find Section 261, which this is Section 261. And Section 261 says, it is the purpose of this subtitle to improve the Medicare program under Title 18 of the Social Security Act, the Medicaid program under Title 19 of such act, and the efficiency and effectiveness of the healthcare system by encouraging the development of a health information system through the establishment of standards and requirements for the electronic transmission of certain health information. Okay. Now, let's see. So, anyway, at some point, they insert the word uniform before the word standards, and they insert, and to reduce the clerical burden on patients, healthcare providers, and health plans before the period at the end. So, let's see if we can find the word standards in here. Oh, I found it. So basically, if we were to go by this, we would read this thing. It is the purpose of this subtitle to improve the Medicare program under Title 18 of the Social Security Act, the Medicaid program under Title 19 of such act, and the efficiency and effectiveness of the healthcare system by encouraging the development of a health information system through the establishment and of uniform standards, I believe that's the word, yeah, uniform standards, and requirements for the electronic transmission of certain health information, which then we would have, and to reduce the clerical burden on patients, healthcare providers, and health plans before the period at the end. Yeah, you get the idea. Alright, so now you've heard it. Operating rules for health information transactions. definition of operating rules. We are now on page number 29 of the healthcare bill. Section 1171 of the Social Security Act, and you are more than welcome to go to Section 1171 of the Social Security Act, okay, is amended by adding at the end of the following operating rules. The term operating rules means the necessary business rules and guidelines for the electronic exchange of information that are not defined by a standard or its implementation specifications as adopted for purposes of this part. So probably what they're saying here, you have to have these necessary business rules and guidelines so that you can electronically exchange information. These things have not been defined by a standard, so if something is not defined by a standard, now it's going to be. Basically what I get out of this. Transaction standards. So the transaction standards are going to be as follows. Operating rules and compliance, Section 1173 of the Social Security Act. So if you go to Section 1173 of the Social Security Act, they're going to amend the dang thing. In subsection A2, so let's go to the Social Security, Section 1173 of the Social Security Act. Let's just go to the Social Security Act. Alright, so we go to Section 1173 of the Social Security Act, and I know this thing is kind of dragging on here. Alright, we go to subsection A2, which subsection A at this point says the financial administrative transactions described in paragraph 2. So and here's the transactions themselves. The transactions referred to in paragraph 1A are transactions with respect to the following. Health claims or equivalent encounter information. So these transactions are either health claims, you're making an actual claim against whatever. Health claim attachment, sometimes you have to attach extra information to the health claim to better explain what the health claim is all about. Enrollment and disenrollment in a health plan, so you have to give information on whether what kind of enrollment you're talking about here, or if somebody has actually disenrolled. Eligibility for a health plan to show if somebody's actually eligible or not. Healthcare payment and remittance advice. So in other words, when they pay out, this is a transaction that would be occurring. Remittance advice, your guess on that is as good as mine. Health plan premium payments, so whenever you pay a payment, that's a transaction. First report of injury, so when they first get a report, it's sent to whatever. Health claim status, okay, so anytime that there's an update on the health claim status, in other words, whether they've actually covered it or they haven't covered it, and if they haven't, then there's a Y. That's a transaction. Referral certification and authorization. Sometimes you have to be referred to a specialist, and if you do, the referral letter, of course, goes to whatever people, probably your health insurance provider. And it could be one of those things where it's actually sent to the Secretary of Health and Human Services. I don't know. They never really got into specifics on this. Electronic funds transfers. Anytime that you are sending money to the health insurance provider, or the health insurance provider is sending money to you, there you go. So anyway, that paragraph number 2 is being amended to say the following. Okay. Obviously, they've added Part J, which was electronic fund transfer. In subsection A, by adding the end to the following new paragraph, Requirements for financial and administrative transactions. Okay. In general, the standards and associated operating rules adopted by the Secretary shall, to the extent feasible and appropriate, enable determination of an individual's eligibility and financial responsibility for specific services prior to or at the point of care. So you have to have a standard to show the person's eligibility for such care and also their financial responsibility to such care. Be comprehensive, requiring minimal augmentation by paper or other communications. Wow. Provide for timely acknowledgement, response, and status reporting that supports a transparent claims and denial management process, including adjudication and appeals. So, in other words, when you submit a claim, you don't have to wait 8 or 9 months to get word back as to whether your claim was approved or not. That's what they mean by timely. And they're not going to add little hidden fees or whatever. They're not going to have little hidden costs that you don't know about until after you got your procedure done. They're not going to play that game on you. Alright, and if they deny you, they have to tell you that in a timely manner. In other words, you're not going to be sitting there in the hospital for 7 months waiting to see whether they are actually going to cover something or not. Okay. Describe all data elements, including reason and remark codes. Now, here's where we get into the complication. You see, many of these companies, these health insurance companies, they like to put numbers from ICD-10, okay, and you can look up ICD-10 and ICD-9 and so on and so forth, and you'll understand. Basically, when you have a disease, it has a code, and they type it in, and bam, that's the code that you go on. But a lot of these people can't read ICD-9 and ICD-10. They just can't read it. So, instead of putting the code, they actually put down the physical explanation as to what your disease is. Anyway, the reduction of clerical burden in adopting standards and operating rules for the transactions referred under paragraph 1. Wow, the Secretary shall seek to reduce the number and complexity of forms. In other words, when you make a claim, you don't want to fill out 50 million forms. By the time you fill out 50 million forms, you're going to probably end up being dead, so they don't want you filling out 50 million forms just to get coverage. And the more complex the form, the more likely you're not going to fill it out anyway. And so therefore the Secretary is saying, wait a minute, we can't have a form this complicated. You can't do that anymore. We made a law that says you can't do that. So when you get your form, it's going to be really easy to fill out. Monkey will be able to do it, so on and so forth. Okay. And this thing just keeps going on and on. I will cover the rest of this in my next video, so stay tuned.